The Lawrence C. Weaver Transformative Community Service Award recognizes a significant institutional commitment to addressing community needs through education, practice, and research. The award highlights community service as an important element of the academic mission. It singles out institutions that serve as examples of social responsiveness in part of an academic's health professional community. Our 2018 recipient is the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences, recognized for its broad and deep connections between students, faculty, and vulnerable communities. Colorado's commitment to community service, which is integrated throughout the curriculum and culture of the university, is a concrete demonstration of the impact that our members have on their communities. Their emphasis on improving the health of rural communities and solving the opioid crisis in Colorado, partnering with federally qualified health centers and community health clinics, and service learning in local elementary schools contributes significantly to the mission and vision of the Academy. The school has developed a network of 12 disease management clinics across the state for patients with diabetes, high blood pressure, and high cholesterol. These student-run clinics have provided more than 8,300 one-on-one education sessions with patients since 2006. Like many states, Colorado faces growing prescription drug misuse and abuse among its population. In 2017, the Colorado legislature created a Center for Substance Abuse Prevention housed in the CU School of Pharmacy, which will focus on further preventing abuse of prescription medications, including opioids. A $1 million allocation from the state will allow pharmacy faculty to coordinate with entities across the state, including law enforcement, local state agencies, and nonprofit organizations, and introduce innovative programs to combat prescription drug misuse. Accepting the Weaver Award on behalf of the University of Colorado is Dr. Gina Moore, and joining her is Dr. Laura Borgelt.
Good afternoon. I think I'm going to repeat much of what you've said, but I'm Gina Moore. I'm the Assistant Dean for Clinical and Professional Affairs at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. On behalf of our Dean, Dr. Ralph Altieri, who had to leave earlier today because his daughter's getting married this weekend in Colorado, and my colleague, Dr. Laura Borgelt, we are incredibly honored to be awarded the 2018 Lawrence C. Weaver Transformative Community Service Award. Our commitment to community service, which we call the Colorado Commitment, speaks to our school's 107-year history of making a difference to the citizens of Colorado. I'd first like to recognize and thank our faculty, staff, students, and preceptors for their dedication and commitment to community service. They are the ones truly responsible for providing education and care to all of our communities. Without them, we could not have received this prestigious and humbling award. We have 4 major initiatives that comprise the Colorado Commitment. The first is our commitment to rural health. Over 1 million Colorado residents live in rural areas of our state with limited healthcare resources. Many work and live in ranching and farming communities where there's a high prevalence of diabetes, cardiovascular disease, and tobacco burden. All of our students, which are 160 in each class, spend 1 or 2 6-week API rotation blocks in a rural disease management clinic in which they provided over 8,300 one-on-one patient visits. In 2016, we passed legislation allowing pharmacists to provide direct patient care under statewide protocols, one of which allows pharmacists to prescribe smoking cessation medications. And in 2018, we passed legislation that mandates reimbursement for pharmacist-provided services in those health professional shortage areas. Our second initiative is our commitment to addressing childhood obesity through our elementary school nutrition program. In the past 10 years, our first-year students have educated over 8,000 students in our local community on healthy eating and other social determinants of health. This program has since expanded to tutoring nights, science fairs, and family health nights for the communities surrounding our campus. Our third initiative is our commitment to federally qualified health centers and community health clinics. Our school currently supports 7 such clinics through shared faculty, PGY2 ambulatory care residents, and dedicated experiential sites for our P4 students. We participate in interdisciplinary teams, home visits, mobile visits to farming sites, and mental health clinics. Our faculty affiliated with these clinics have been honored with numerous awards, including the ASHP Best Practice Award and ACCP New Clinical Practitioner Award. Our students launched a student-run free clinic named the Dawn Clinic, which you saw pictures of, in 2015, which provides care to our local residents of our community. The clinic was recognized by our governor and honored with the 2016 AACP Student Engaged Community Service Award. And our fourth initiative is the Colorado Consortium for Prescription Drug Abuse Prevention. Led by one of our faculty members, Dr. Rob Ballack, the consortium was tasked with the Colorado Governor and Attorney General to provide a coordinated statewide response to prescription drug abuse. Through public outreach, education, safe disposal initiatives, and naloxone legislation, the group was able to prevent 92,000 Coloradans from misusing opioids. The consortium was also instrumental in passing 5 new bills in the 2018 session this past May. We are pleased to donate the monies from this award to augment public service campaigns to educate the public on the dangers of opioids and highlight the important role of the pharmacists in communities throughout our state. We are grateful to AACP. Thank you, Lynette, for your visits to Colorado in December, and proud to honor the legacy of Dr. Lawrence Weaver in receiving this award. Thank you very much.